Hi folks, so today's topic is rheumatic heart disease. Question that I received after several exams. Actually, I'll try to clarify these points, your questions. Actually, it will be not helpful only for your board big exams, but I suppose it will be helpful also for young doctors as well, for your future medical practice. So let's go, my beloveds. Then first point that provokes a problem, I don't know why. So that rheumatic heart disease, we talked about it, we used to talk about it, is a significant global health concern, especially in developing countries. So resulting from rheumatic fever, we used to talk about that several lectures ago, 2 lectures ago, caused by Group A Streptococcus, gas, GAC, no acronym, Group A Streptococcus. So let's talk about your principal problems on exams. Rheumatic heart disease is a sequela of rheumatic fever. Yes, of course. It's a sequela up to you how to pronounce, of rheumatic fever. Rheumatic heart disease is a chronic condition that develops as a long-term complication of acute rheumatic fever, REF. Of course, it's a complication of acute rheumatic fever. So it's an autoimmune reaction, definitely. It's an autoimmune reaction, autoimmune, abnormal of course, autoimmune reaction to Group A streptococcal pharyngitis. Group A streptococcal pharyngitis. Right, don't look at me, write it please. So what is clinical issue of that? That early diagnose an adequate antibiotic treatment of streptococcal streptococcal throat infections are essential to prevent this acute rheumatic fever and by that subsequent rheumatic heart disease. What is difficult here? About complications on the heart, that's why it's rheumatic heart disease. Of course, it's a mitral valve. It's the most commonly affected valve. Why valve? Because it's a connective tissue. All autoimmune disorders, we can say all. It's a rheumatic tissue problem because vast majority of our body, 75-80%, it's water, no liquid. The rest, we can say, the vast majority of solid parts is a connective tissue, and the mitral valve is involved because it's also connective tissue. And this is an area that this Group A streptococcal adores to live. So that's why mitral valve is involved in up to 70% of all cases, and often leading to mitral failure, mitral stenosis or regurgitation. The aortic valve is the second most affected. Yes, it's happened, and we see and mitral valve and aortic valve as well. But the principle is the mitral one, then aortic one. So that's why it's so important recognition of mitral stenosis murmur. This murmur is mild diastolic rumble at the apex. Okay? And the mitral regurgitation, sometimes we said failure, insufficiency, why not? So mitral regurgitation murmur, it's a holosystolic murmur at the apex. So mitral stenosis, write it, mild diastolic rumble at the apex, and the mitral regurgitation murmur, it's a holosystolic murmur at the apex. It's a crucial in the clinical examination, this recognition. Of course, now we have echocardiography, easy peasy to, I suppose every cardiologist must to understand how to make technicians questions of the echocardiography and find this problem of the mitral valves. No, anyway. Then, molecular mimicry is the main pathogenic mechanism. What does it mean? Body mistakenly targets its own tissue because streptococcal M proteins resemble cardiac myosin myosin and valvular tissue, leading to autoimmune damage. So why some persons got this problem, some persons no idea, it's a speculation. But we know that body mistakenly autoimmune response targets its own tissues because of streptococcal M proteins that resemble cardiac myosin and valvular tissue, leading to autoimmune damage. What is clinical issue of that? Understanding this autoimmune mechanism, my beloveds, aids in explaining to your professor on exams why some individuals develop RHD following streptococcal infections, while others does not. And I answer, I repeat, no idea, it's speculation why some persons develop this RHD and others not. But you understand this manner. Then RHD means rheumatic heart disease. While the initial acute rheumatic fever episodes occurs in childhood, the long-term sequelae, including heart failure and valve disease, manifests in young adulthood. What is clinical importance of that? Early detection and continuous antibiotic prophylaxis can prevent, and we know that, recurrent infections and subsequent valve damage. About Jones criteria, once again, my beloveds, the Jones criteria include major, may have to remember that of course, carditis, polyarthritis, chorea, erythema marginatum, subcutaneous nodules, and minor fever, arthralgia, elevated ESR, CRP, seroreactive protein ratio, prolonged PR interval criteria. But you have to remember them, for Jones criteria, the questions that adores professors, actually I don't know why, on the big exams, and I find this Jones criteria in every questions, oral exams, MCQ tests, everywhere. No, there is a reason, of course, there is a point in there. So anyway, remembering major criteria of Jones criteria, modified Jones criteria, doesn't matter. Jones criteria of rheumatic fever or rheumatic heart disease. Carditis, polyarthritis, Korea, not North Korea, just Korea or South Korea as well, neither. So carditis, polyarthritis, Korea, erythema marginatum, and subcutaneous nodules, and minor fever, arthralgia, elevated ratio ESR, CRP, prolonged PR interval criteria. Clinical importance. Knowing these criteria helps in timely diagnosis and initiating penicillin prophylaxis to reduce the risk of developing rheumatic heart disease. About chronic inflammation. Does chronic inflammation lead to fibrosis and calcification? Definitely, my beloveds, in every question there is an answer. Of course, the inflammation from acute rheumatic fever can result in scarring and calcification of heart valves, leading to stenosis, regurgitation, or a combination of both. Clinical issue. These can eventually cause chronic heart failure, warranting surgical intervention, including valve repair or replacement. So do everything before to avoid this situation, the surgical intervention. Because patients will be a whole life on medications for this valve, artificial valve. So subclinical carditis, often missed. Yes, is often missed. Subclinical carditis, detectable only on echocardiography, must be present without obvious signs or symptoms during the initial acute rheumatic fever. That's why we need to have a good technician on echocardiography. Not all cardiologists can do this fine echocardiography. So, but clinical routines, clinical importance of that routine use of echocardiography in suspected cases by a good technician can aid in early diagnosis and appropriate management. No question of that. That's why what is gold standard for diagnosis? Of course it's echocardiography. Question is, what the gold standard of diagnosis for diagnosis of rheumatic heart disease? RHD is rheumatic heart disease. Definitely echocardiography that helps detect valvular lesions, chamber enlargement, hemodynamic disturbances. So that's why clinical importance of that is regular echocardiographic screening, especially in endemic areas, helps in early identification of valve problems, no valve's involvement. What about secondary prophylaxis? Of course, it's a benzathine penicillin. Benzathine, up to you how to pronounce. Penicillin G. Patients with rheumatic heart disease require long-term benzathine, penicillin G prophylaxis. Penicillin G. To prevent recurrent infections and worsening valve disease. And we prescribe it long-term. Okay? So clinical issue of that the duration of prophylaxis prevention, that is, may extend for years, not years, decades, depending on age, severity, and risk factors for recurrence. Yes? About surgical intervention. When valve damage becomes severe or symptomatic, surgical options include valvuloplasty, valvular replacement, or repair. What is clinical importance of that, my beloveds? Post-surgical care involves, you have to understand, and you have to explain this to your patient, lifelong anticoagulation, especially if mechanical valves are used, and continued prophylaxis to prevent recurrent acute rheumatic fever. And we remember that the problem also, it's atrial fibrillation. About atrial fibrillation we'll talk. Actually, I don't know why. What types of arrhythmia is one of the most serious and dangerous complications is atrial fibrillation. So, rheumatic heart disease is a preventable and manageable, but timely recognition, accurate diagnosis, and prophylaxis, my beloveds, against streptococcal infections are crucial. So, understanding the pathogenesis, clinical features, and management, healthcare professionals, means you, save lives and improve patients' outcomes. Largely sufficient. So I answered all these questions from your big exams, board exams. Success.